You've heard from David this afternoon. You know that he's the Managing Director for Health and the Interim Managing Director for Human Services at the Kresge Foundation. He, too, has been with the Roundtable from the beginning. What you may not have known is that he has a master's in divinity, and so he's the perfect person to provide the benediction for this particular panel. David Kresge.
Like any good person with religious training, I really don't have anything substantive to add except to bless what happened. Because I think the panel did a pretty good job of, I think, sounding out sort of the key themes in terms of kind of both a funder perspective and a sort of a funder assessment of where things are at. And I actually do think most of the major things that I was thinking about were sort of touched upon in everybody's remarks. But I do want to sort of, again, offer a perspective. But go back to Marion's remarks, because I do think that what foundations do or can bring to the table is in fact a very values or mission-driven point of view about all this stuff. So we're not constrained like government, like other sectors might be in this particular area. And in that we could speak on behalf or support communities that have been marginalized. And three, we can sort of take the long view. And even those of you who say that foundations are very fickle, I agree with you. But in fact, I think foundations can be and have been the progenitors of long-term social movements. And about the food stuff, I tell this to people, and I'm not from the Kellogg Foundation, but I will say that we would not have a food movement today were it not for early investments by the Kellogg Foundation. They funded every important advocate, for the last probably 5 decades, and also the experiments on the ground. So, the fact that we're talking about local and equitable and sustainable these days is largely because of a lot of those investments, not entirely, but same Robert Wood Johnson Foundation. I think every panel mentioned them. Their staying power and presence in this field is legendary, and justly so. And I think that their fix on this culture of health, whatever that means, and we all scratch our heads and say, what are you talking about? But in the end, I think we know what they are intuitively, what they do mean by this, and we hope and trust that it will lead to some larger change about how we think about these things. So I think for the long haul, foundations are not going to be fatigued by this or any other issue. What I think does change is maybe the container for this kind of stuff. And just from my perspective, here I'm speaking from the Kresge Foundation. For those of you who don't know, we're not a health foundation. We're actually a community development foundation, and we have a health program within it. And my perspective, at Kresge has allowed me to sort of see other sectors and moving. And just a few observations. One is that health is clearly becoming a central theme in a lot of different things, especially in community development. And so you have people in the community development area, and that includes people in transit planning and housing, economic development, workforce development, where health is actually becoming a critical integrating factor or important partner that may not have been at the table before. This is not because I've been at those tables and encouraged it. People, in the foundation, totally independent from me, have come back to me after their conversations in the field and say, health is really the organizing theme here. A person who's been working, actually works for both RWJ and ourselves, working on the area of how to help communities absorb capital. So there's lots of money, but actually communities don't always know how to use this in an equitable and sustainable way. I mean, they dump money, and the latest project, more highways, other economic development, but without thinking about, are there more strategic ways of doing this? Because they don't really have systems to absorb that capital in a way, that they can use it meaningfully. And they say, she was just saying, the work around hospital anchor institution strategies that institutions like Kaiser Permanente have done, or University Hospitals in Cleveland have moved forward. are really becoming a foundation for community development. And so it's health institutions which are driving community development on the one hand, and increasingly they're driving it not only towards standard development projects, but projects that actually can produce greater health for people. And so we see, that conversation, and we're seeing it from also other sectors that you would not kind of begin to expect. So earlier, the Partners for Healthier America brought up the partnership now with affordable housing. And so housing is becoming a sector where, an increasingly important sector for thinking about health in general, because housing is actually a huge part of the cost for the healthcare system, in the sense that people who are unstably housed are very, very expensive. But this has a lot of relationship to health, because if you help people's housing, you improve their health. And as you know, the Moving to Opportunity demonstration, which was about economic mobility, showed relatively mixed results on that score, but it did show clear, significant results for health, including obesity, especially for the moms and the daughters. These kinds of data are beginning to percolate in these other sectors. So we're seeing that. There's clearly now new capital flows, and one thing that foundations can do with their money, besides give us just straight out subsidy, is they can also do PRIs or other kinds of leveraged kinds of instruments. And what we're seeing in that kind of area is that it's attracting now a lot of private investment into health, or at least prosperity producing kinds of activities or investments. So as many of you are familiar with the Healthy Food Financing Initiative, the idea of also financing retail and other food enterprises and communities. The interesting thing in the last few years is that it's no longer simply, below market rate foundation PRIs which are coming into this area, but you have actually market rate investments coming in from big banks like JP Morgan and Goldman Sachs, et cetera. So we see this sort of flow of new capital, and foundations have been sort of at the table and trying to encourage these more sort of mission-driven kinds of investments in communities, and also working with the health system itself. And so the endowment, along with some other foundations in California, is soon going to launch Accountable Communities for Health. Nationally, Kresge and other foundations have been working with Medicaid and other health systems to think about how to leverage those dollars in the system, for things like community population health. So I'll just sort of stop there. And
well, now the people say amen. And thank you very much. Please join me in thanking the panel.